A breast augmentation is a procedure by which we increase the size of the breast. There are different types of breast augmentation, and generally speaking, there is the question of whether the breast augmentation, the implant is placed over or under the muscle, and also the type of implant or the type of material used. So it can be silicone breast implants which are used, or it can be patient's own tissue, as in fat transfer, which can be used to enhance the breast. Well, breast augmentation, as I've already said, it will do an enhancement of the size. But what it won't do is, if there is excessive drooping of the breast, it will not lift the breast. And in those cases, an additional procedure of lifting the breast by surgical means called a mastopexy will be required. The scars from breast augmentation in most cases are in or near the crease under the breast. That is more than 90% of the time. That's the approach which is used, and that's where the scar will be. However, there are other approaches which can be used, for example, from the armpit or from around the nipple. So there are a number of other approaches which are used, but they are rare. Generally, the operation can take between 35 and 45 minutes, depending on a number of factors, but on average, say 40 to 45 minutes. That's the time the surgery takes. However, you're in theatre for up to an hour and a half to 2 hours, because it takes time for you to go to sleep and then recover from the anesthesia before you go back to the ward. The surgery of breast augmentation can be done either as a day case, whereas you come in, have the surgery, recover from the anesthesia, and once you're feeling well enough, you can go home. And that's usually done when your surgery is done early in the morning and you can go home in the evening, or it can be that you stay overnight. At this moment, the majority of my patients would stay overnight in the hospital and go the next day. Well, there are two types of risks. One is general risks, which are the risk of any surgery. So you've got risks like risk of hematoma, risk of infection, risk of bad scarring. These are generic risks and they apply to any surgery. Specific to breast augmentation itself, there are two main things that you need to know about. One is called a capsular contracture, and capsular contracture means that once the implant is placed within the breast itself or underneath the breast itself, the body lays down a layer of scar tissue around the implant. In most cases, that is a thin layer of scar tissue which doesn't change. In about 6 to 8% of patients, this scar tissue gradually thickens and tightens, and patients talk about it as if the implant has gone hard. It's not the implant that goes hard, it's the scar tissue which actually thickens and tightens. The other risk is implant rupture or leakage. And with modern implants, while the risk is very low, it is a risk that you need to be aware of. Well, the lifespan of breast implant would be considered between 10 to 15 years. These are artificial after all. And anybody who is considering breast augmentation should be aware of the fact that between 10 and 15 years time, they should consider having the implants changed. Well, recovery varies from person to person, but on average, after 2 weeks, if you go back to light activities or say desk-based work, that's quite possible, and most people achieve that. When it comes to the implants being placed under the muscle, there is a restriction in terms of not being able to lift heavy objects or doing upper body exercise. And if your work or your social activities involve that type of activity, then it would be better to avoid that for at least 6 weeks. The other thing that is important to remember is that you should avoid driving for 2 weeks after this operation. We provide a 24/7 hotline, which means that at any stage after the operation, if you wanted to get in touch with either the hospital or the clinic, you can get in touch with us. If you've got a question, that will be answered. If there is a problem that needs the input of a surgeon, then the surgeon is informed and arrangement is made for you to be seen. However, that's rare. The routine is that you have your surgery, you're seen by the surgeon, we make sure that everything is okay. Then you go home, you come back at 2 weeks for a wound check and to make sure that everything is progressing as it should. Then you are seen again at 6 weeks, and again, if need be, after that. Once everything has settled down to the satisfaction of the surgeon and to yourself, then we offer an annual review, which is free of cost on an ongoing basis.